Hello, everyone. Welcome to the Medicare 101 webinar. I want to thank you for taking the time to come and listen to this presentation. My name is Rick. I'm from LegacyCare Insurance. Just one little housekeeping item. You may have received the worksheet prior to coming to this webinar. If you did not, that's not a problem. Just take a blank sheet of paper, put a line down the center, put Medicare Supplement on the left and Medicare Advantage on the right. It's just for you to take notes as we go along, to capture any questions you may have for our one-on-one meeting later. I may have suggestions for things for you to write on that sheet of paper. So it's just an advantage for you to be able to remember what was said and to keep track of your thoughts and questions. So who am I? My name is Rick. As I stated before, I'm a proud husband, father, and grandfather of 5 grandchildren. From these pictures, you can kind of see what I love to do. You can see my wife, Carol, on the top left. Love to spend time with her and the family, whether that's at home or on vacation. On the bottom picture, you can see I'm with my grandkids as we're walking around the neighborhood. So just being able to spend quality time with them is what really my wife and I love to do. I'm the founder of LegacyCare Insurance. I am a Medicare specialist. That's what I do. I'm an educator and planner. So, LegacyCare Insurance, who are we? As from the name, care is at the center of everything we do. It's LegacyCare Insurance. As a former pastor, I've walked with families through life's unexpected challenges. And I bring that same kind of heartfelt care to helping you find the best Medicare solution for your unique needs, your situation. Care is at the heart of what we do. It starts with my care for you, by listening to your questions, your needs. It's represented by the solutions that I provide. These solutions help cover some of the exposures or gaps that are in Medicare. And the name of these solutions are XtraCare, TotalCare, and MaxCare. You'll see these solutions later on in this presentation. These solutions are there so that you can love those close to you and your family or friends better because you're receiving the care you need. And not only are you receiving care, but I think it also helps your loved ones care for you during those unexpected health challenges. So one of the ways I do this is by focusing on education, being able to answer your questions. And that's done through webinars like this, like you've come to this digital learning. I also do in-person learning, whether that's at a larger event, as you see on the screen, or it's one-on-one with people. As part of that education piece, let's just move right on into what is Medicare? What is original Medicare? When people use that term, what does it mean? And so it's basically consists of 2 main parts. There's part A, which is hospital coverage, and that's generally $0 premium for most people. If you've worked 40 quarters during your career, you will get that at 0 premium. And then the second part is doctor coverage. So basically any healthcare coverage that happens outside of a hospital, that's your part B. And that has a monthly premium of $185 for most people. If you have higher levels of income, you will pay a little bit higher on your monthly premiums the more money you make. So those are the 2 main parts. When people say original Medicare, they're referring to Part A and Part B. And so what are the scenarios as you're thinking about enrolling in Medicare, whether you turn 65 or you're working? There are 3 main scenarios that we're going to cover now. And there's the 3 scenarios on the screen. So let's just go ahead and hit on scenario 1. Scenario 1 is if you're currently receiving Social Security benefits and you want to enroll in Medicare. This is really the easiest scenario that we have because you're going to automatically be enrolled in parts A and B. The parts that we talked about earlier, you'll automatically be enrolled. You don't have to do anything. You will receive your original Medicare, that red, white, and blue card, roughly 3 months before your birthday month. And that $185 is going to automatically be taken out of your Social Security check. That's scenario 1. Scenario 2 is you do not receive Social Security benefits currently. And in this case, you're going to have to manually enroll in Original Medicare. They will not do it automatically. There's several ways in which you can do that, as you see on the screen here. You can do it online, and that's by going to the Social Security Administration's website at the link that you see there, www.ssa.gov/benefits/Medicare. You can do it over the phone by calling their 800 number, or you can schedule an appointment and go do it in person at the Social Security office. The fourth way is you can actually get an application and mail it in. When you do it this way, you're going to be billed quarterly. And so don't be surprised when you see that quarterly bill come in at $555. That's $185 times 3. You'll be billed quarterly to pay that on a quarterly basis. And then the third scenario is you're still working. Okay, so you're covered under your employer health plan. And you got two choices here. You can still enroll in Medicare effective on your 65th birthday month, or you can delay Part B until you retire. And then after you leave that Medicare plan, you can then enroll in Part B. And there will be no penalty, as we're going to discuss about later. There's no penalty for delaying it if you work for an employer that has more than 20 employees. If it's less than 20, then you're going to want to and still need to enroll in Medicare's Part A and B. And so one of the things that you do in this scenario is, even if you're on an employer plan, we can still sit down and compare the cost, deductibles, max out-of-pockets, how much you're paying in premiums, just to find out which of those two plans is better for you. And if your employer plan is better, that's the case where you would delay it. When does Medicare begin? If you enroll in Medicare, you enroll in your Parts A and B, your coverage actually begins the first day of the month of your birthday month if you're turning 65. And so earlier I talked about that there are exposures in Original Medicare. And as you're going to see on this chart, there are two main exposures. There's an exposure in Part A, that's that hospital coverage. When you're in a hospital, it pretty much covers everything that happens while you're in the hospital. However, there's a deductible. There's a $1,667 deductible in 2025 for each hospital stay that you have during the year. You will pay that deductible for each separate hospital. Part B, you also have even a bigger exposure in Part B. You have a small deductible, $257 this calendar year in 2025. But the biggest exposure you have is that you have to pay 20% of all your healthcare costs. So Medicare pays 80%, but you pay 20%. And that can be a big amount. If you have to have chemotherapy, radiation, if you have heart attack, cancer, or stroke, where you have to have a lot of care, you're going to be paying 20% of a very large bill. There's a third exposure, and that's Part B excess charges, where you have to pay an extra 15% on top of what Medicare charges. Some doctors can charge that extra 50%. There are very few doctors that do that, and it's really only 15% of the 20%. So this is really not a thing to really concern yourself with, but wanted to make sure you were aware of that also. So we'll be talking how you can cover these exposures. So another thing that we want to make sure you don't face is penalties, because when you get a penalty on Medicare, it really lasts for the rest of your life. And there are a couple different kinds of penalties. The one is you pay a 10% penalty on Parts A and B, and only on Part A if you don't have premium-free Part A. So if you didn't get your 40 quarters in, you're going to be paying a premium on Part A. If you're late, you're going to pay a 10% penalty for every year that you're late. Part B is the same. If you don't enroll in Part B when you're required to, you're going to get a 10% penalty for every year that you weren't covered under Medicare. And then Part D, we haven't talked about Part D yet. That's your prescription drug plan. That one's a little different in that each month that you don't have creditable coverage, if you've gone more than 63 days without that coverage, you're going to pay 1% per month for every month you don't have drug coverage. So that comes out 12% a year, but it's each month. It goes on a month-by-month basis. So you'll want to make sure that you enroll in these when the time comes in your qualify and the government requires you to. So let's talk about two main options you have to cover those exposures, at least part of those exposures that we were talking about earlier. And those two options are a supplement plan that works with original Medicare and then an Advantage plan. We'll cover both of these on the coming slides. And so this goes into kind of a graphical piece of describing these and showing what these two options look like. So that first piece, that supplement insurance piece, once you're going down the left-hand side, you're basically going to stay on original Medicare, Parts A and B, but then you're going to add a supplement plan. When you add that supplement plan, it covers a lot of the gaps in Part A and B, and the most popular plans cover all the gaps except for that $257 deductible. And then you also have to add a Part D, a prescription drug plan to that, because supplement plans do not include your drug coverage. Now, when you go to the right on this chart, and that's why I had you have a line down the middle, you're going to start taking notes on these two, supplement on the left, Advantage on the right. So on the right side, you have what's called Part C. That's also known as an Advantage plan. And that basically combines Parts A and B. It actually goes out to a private insurance company that provides your insurance. It's managed care, and they combine them. It's Part A and B. You're then going to have a card from that insurance carrier that you give to the doctor instead of your original Medicare card. Part C usually covers your Part D prescription drug coverage. You can get plans without it, but for the most part, they have Part D. They also include some extra coverage, supplemental coverage that we'll talk about later. So in these two options, let's do a quick comparison before we go into the details. With the supplement plan, you're still going to pay your Part B premium. All right, that isn't going to go away. You pay that premium, and then you also have an additional premium with the supplement plan that you choose. And we're going to get into which two supplement plans are the most popular coming up. And the coverage on this, you have the lowest out-of-pocket expenses. So you're going to pay that premium every month, but you're not going to have a pay-as-you-go for the different procedures or hospital stays or doctor visits that you have. You'll only have that $257 deductible. The network, this network coverage is the most comprehensive you can get. You can basically choose any doctor, any hospital that's contracted with Medicare in the United States. You don't need any referrals. It gives you the most flexibility. And then you're going to choose a prescription drug plan to go along with that supplement. As we now switch gears and look at the Advantage plan, you still have to pay the Part B premium. On this, your out-of-pocket costs are higher. So as you go through the year, you're going to continue to pay for your care as you make specialist doctor visits, have procedures done, or go to the hospital. There's co-pays and co-insurance that go along with that. You do have a network. That's why it's called managed care. You're going to have to see the doctors that are in your network to get the lowest contracted prices. So you will want to pay attention to that and know that your doctors are in the Medicare Advantage plan that you choose. It typically comes with a Part D plan. It has extra benefits. I mentioned that earlier. These benefits can include your dental, vision, and hearing coverage. They can include gym memberships. They have some over-the-counter benefits. So you get some of these additional benefits bundled in with the Medicare Advantage plan. And this kind of shows you a side-by-side. So if you want to be taking some notes, maybe take some of the differences, and they are basically supplement. You have the most comprehensive coverage. You're going to pay more for your premium. In that case, you can choose any doctor. On the Medicare Advantage side, you usually do not have a premium. If you do, it's generally a lower premium than you have on the other side, but you have managed care. You have to stay within your networks, but you get some extra benefits. So let's start looking at some of the options that you have in addition to those two to cover some of those exposures that we talked about. The first is what we call the big three. These are the big three critical illnesses: cancer, heart attack, and stroke. We're going to recommend in these care packages that we're going to mention to you shortly, we're going to recommend that you get one of these plans because they will help with your out-of-pocket expenses. Even if a lot of your medical expenses are covered, you have a lot of expenses associated with these and the care that comes as you're recovering from it, and travel costs and food costs and all that kind of stuff that can come with the care that's needed for these major illnesses. One of the other big outages that you see in Medicare, whether it's supplement plan or an advantage plan, is skilled nursing coverage. You will notice that Medicare covers your first 20 days of skilled nursing coverage after you leave the hospital and you're recovering. You can go into a skilled nursing facility and they will pay the first 20 days. But look at days 21 through 100. You're going to be paying a little over $200. But after day 100, if you need more than 100 days of skilled nursing, you're going to pay all the costs. This is a big exposure. You will pay all costs for your skilled nursing care after day 100. This is specified in the Medicare documentation that comes from CMS, that comes from the government. You can see that skilled nursing care requires a 3-day minimum stay in a hospital. So after that 3-day minimum, you can then get skilled nursing care that pays days 1 through 20. For most of that, you pay nothing, but days 21 through 100, you pay those costs. And you can see right here on this sheet, it may be a little small for you, but you can see down here at the bottom how you're going to be paying over $200 for like 80 days of coverage, 21 through 100. And after that, you pay all costs. And this is after a 3-day stay in a hospital. So I just wanted you to see that comes out of the Medicare and You 2025 document that the government will send you when you enroll in Medicare. And so what are some of the solutions that we recommend to help cover these exposures? And you can see on this sheet, there are 3 packages of solutions. And I call them care coverage solutions. And so on the left, you start with what I call XtraCare, and that provides you not only your base plan, but it adds that cancer, heart attack, and stroke to it, those 3 critical illnesses where a lot of your expenses come from when you need medical care. The middle package I call TotalCare. It adds to that either a dental, vision, and hearing plan for a supplement plan, since it doesn't include those, or a hospital indemnity plan if you're on an advantage plan, because you have daily costs associated with that advantage plan. And they're usually somewhere in the $300 to $500 a day costs when you go into the hospital. Some plans are 5 days, some are 7, but you're going to have those copays when you go to the hospital. These plans will help cover that. And then the MaxCare adds that recovery care. And that recovery care is meant for that skilled nursing facility, the outage that we had there on over 100 days, and even days 21 through 100, where you have to pay like $200 or more a day for that coverage. These recovery care plans will cover up to 360 days of coverage for you, most of them do not require you to be in the hospital first. And so let's go into a little more detail on that supplement plan that we were talking about. That's option 1. This is the left side of your sheet if you want to take notes. Again, this is just repeats the major exposures because these are the exposures you're going to have on original Medicare. This is at $1,676 and the 20%. And so you can see here, what does this look like? You have original Medicare, you add your supplement, then you add your prescription drug plan. This chart just shows you that you need all 3 of these to cover the big gaps. And then here, part 1 is your supplement plan. What is a supplement? Or it's also known as a Medigap plan. This is a private health insurance company that basically covers all those gaps, the $1,676 and that 20% that we had in parts A and B. And so on this sheet, you can see there are multiple plans, like 10 different letters. Now, don't get these confused with the parts of Medicare. These are plans. It's really confusing because they use some of the same letters, but these are plans under supplement plans. And there's really just 2 I'm going to talk to you about today. and that is G. This is by far the most popular plan for those entering Medicare now. And then Part N, the one over here in the right column. These are the most popular and the only ones I would really recommend unless you have a very unique situation. But G covers all these gaps that are mentioned on this side. And you can see it covers 100% of all of these until you get down to this Part B deductible. That's that $257 that we were talking about. It also provides for foreign travel, which original Medicare does not. And then N is basically like G, except you have a couple added things that you have to pay. One is doctor visits. You have to pay a $20 copay. So when you go to the doctor, whether it's a primary care or a specialist, you're going to pay a $20 copay each time you go. And then you also, it doesn't cover those excess charges that we were talking about, that 15% the doctors can add. So that is what you have to pay for N. So why would you get an N instead of a G since you have some extra copays? It's because the premiums are cheaper. And so if you only go to a doctor like once a month or less, N premiums generally tend to be cheap enough that it would be lower cost for you to go with an N. And so they're both good plans. It just depends on your situation and how often you go see the doctor on which one of those two you would choose. And so here we get back into the skilled nursing care. I just want to reiterate that after day 20, you're going to have costs of $209 each day. And then after day 100, all costs. That's what that recovery care in that MaxCare package that we add, that's what that is meant to address, these costs that can get quite expensive. You have to spend a lot of money on skilled nursing care. And those recovery care plans also can include a health care plan so that you can have skilled nursing at home if you desire. So what is the cost of a Plan G? We talked that you're going to have extra premiums depending on where you live in the country. You're going to spend anywhere from about $100 to $200 on the premium every month for Plan G, right? It all depends on the zip code you live in, what state you live in. Those costs are going to vary from state to state and from zip code to zip code. So we can look up, based on where you live, what the rates are for a Plan G. So which supplement plan is best? I've already covered this, but if you want to write this down, a Plan G premium is about $100 to $200 on the left-hand side of your paper. Plan N is generally $20 to $40 cheaper, depending on which state you live in, which carrier you get with, the coverage with. And yeah, it depends on your situation on which is going to be better for you. Oh, there's also a $50 emergency room visit. If you're admitted to the hospital, they waive that $50 copay. The other thing I want to mention about a Plan G and N that's different than an Advantage plan, these plans are regulated, they're standard. A Plan G is a Plan G no matter which insurance carrier you get it with. They have to cover the same thing. They're just covering gaps. A Plan N is a Plan N no matter which carrier you get it with. So you got to just take it based on the stability of the carrier and what the cost of the premiums are, because they will vary. So what are the key points on when you can enroll in a Medicare supplement plan? And so the best time to enroll in a supplement plan is the 6 months prior to your birthday month. There's actually a 6-month period from your birthday month and after that you can enroll in a Medicare supplement plan that's guaranteed issue. They cannot ask you medical questions no matter where you live in the United States. There is a 6-month window from your birthday out in which you can enroll in a plan with there's a guarantee issue. They can't decline you. And so if you're in poor health, you really want to consider enrolling in it no later than that 6-month period. But also you can enroll in it to it 6 months prior just to make sure you have your ducks in a row. You have time to think about it. You're not making a rash decision. You're just thinking about these, and we can help you walk through that process. I already talked about the standardized plans. That's on the bottom half of this sheet. So what are some of the myths as we talk about these plans? How do we help you? And so one of the myths is that I must have to pay a fee to use a broker to get this help, right? Because we're going over a lot of information when we sit down with you one-on-one. There's a lot of options. It would take you a long time to go through all these options. We're trained, we're certified. We have a lot of education on these options that you can choose. And so you're wondering, how do we get paid? Do you have to pay for this? And the truth is, no, there is no charge to you. There's no fees of any kind to you for our services. And so myth number 2 is nobody works for free. The insurance company must then charge a higher price if we work through a broker. And the truth is, you pay the exact same price whether you go through a broker who's been certified and trained on this to help you through all your options, as if you go directly to the carrier. And as an independent broker, we represent multiple carriers, so we can do the spectrum and show you which plan, which insurance carrier would work best for your situation. So they charge you the same amount whether you go through a broker or straight through them. So that's the truth about myth number 2. Myth number 3 is if you get paid by an insurance company, you must have a bias toward one company or the other. And we have access to over 15 different companies, insurance companies that we go through. And so we have a wide choice, and it just depends on, as we ask you questions and go over your specific needs, we can really tailor it to the carrier that best suits your need. We're not really biased by one company or another. And so here again is just the truths. There are no fees charged. You're not going to pay a higher price by going through us instead of straight through a carrier. And then truth number 3 is we have a lot of companies to choose from. Here's just some of those companies that we work with, right? That provide not only your Medicare supplement or Advantage plan, but also those care choices that we talked to you about, those other ancillary products that we can add on top of Medicare. So let's talk a little bit now about prescription drug coverage. This is Part D. We haven't touched on it yet, so we're just going to look at this briefly because it was the third part of when you go the left option route, option number 1, you need to add a drug plan in addition to your supplement plan. And so this prescription drug plan covers your prescription drugs. You have to enroll in a standalone plan when you take a supplement. You're going to want to make sure you do that because you don't want that penalty on your coverage of 1% a month that we talked about earlier. And so what is our process for Part D? You give us your list of drugs. We input that into an online calculator. We have tools in which we can do that. You choose your pharmacy. And then with those tools, we compare all the plans in your zip code to see which one offers you the best coverage at the lowest price. And then we help you enroll into that plan of your choice. And then every year during the annual election period, October 15th to December 7th, you should review that plan because your Part D drug plans, the formularies they have, the drugs on their list can change. And so we would reevaluate and make sure that you're still on the best Part D plan. Once again, this just basically lays out what your costs are going to be. Original Medicare, write down $185 on the left side. You're going to pay for your Plan G or Plan N, anywhere from $100 to $200. And then you're going to pay for your prescription drug plan. I think the average cost of a prescription drug plan was roughly $40 this year. So you can get some as low as $0, and others you're going to be paying $100 or more. But average, it's around $40 a month. So write those costs down on the left-hand side so you can see how much you're going to be paying per month for those. Now let's go to option 2, which is the Medicare Advantage plan. In option 2, you basically have your managed care plan. So it's going to replace Part A and B. It's going to include your prescription drug plan. And most of these plans have a $0 premium. You're still going to pay the $185, but you don't have that extra $100 to $200 premium for the actual Advantage plan itself. You don't have to pay extra for Part D if it's included in your plan. So you're going to save some money on premiums there. But look on the right column. Look over here at your coverage. As you go, you're going to have copays and deductibles and co-insurance, right? And so these you pay as you go, but there's a max out of pocket. So you want to make sure as you look at your plan, not only do you look at the copays and deductibles, look at what that max out of pocket is for each plan, because that's what caps what you have to spend. If you got a cancer, or which you have to pay a Part B 20% on a cancer treatment, can be very high. This max out of pocket helps cap that at that maximum amount. Your doctors, hospitals, medications are all going to be different based on the region and area you live in. Some regions have very good networks, lots of doctors, great hospitals, great coverage, great medications. Your medications will be covered. These work well for a lot of people. You also get the extra benefits like dental, vision, and hearing, and gym, and over-the-counter benefits. So as we look at your situation, we can quickly determine, hey, which route do you want to go, supplement or advantage? And then with an advantage, we can choose the plan that best works for you if you decide to go that route. So when do you enroll in an advantage plan? You enroll, your initial enrollment period is 3 months before you turn 65, your birth month, and 3 months after. That's a 7-month window that you have when you turn 65 to enroll in that plan. You can also delay it if you have employer coverage. You can wait to get this until you get Part B later. And then there's also this annual election period that you have every October 15th to December 7th. You can enroll in a new Advantage plan. You can change your Advantage plans. You can go back to original Medicare if you want. Every year from October 15th to December 7th is known as your annual election period. Some people call it an open enrollment period, but the technical term is AEP, annual election period. And that effective date when you change it starts the beginning of the next year on January 1st. So let's compare the two options. Here's that same sheet as if you were taking notes as you're going along. Make sure that you have this down. But basically, most flexibility with supplement. You have an extra premium. It's got the lowest out-of-pocket costs as you go through the year. You can see any doctor. Advantage plan. You have lower premiums. You pay as you go. There's that max out-of-pocket that helps cap the most you can spend for Medicare covered expenses. And then it has some extra benefits. So that's basically the difference between the two. And again, I want to reiterate that here are our care coverage solutions for you. In addition to that base plan that we've been talking about, you can get the cancer, heart, and stroke, the dental, vision, and hearing additions, and the recovery care to help with those extra exposures as you go through so that you get the best care. Last thing, when you're talking retirement, you're talking Medicare, you also want to protect your money. You not only have a health care transition, you normally have a financial transition also around this time as you think about that next phase of your life, whether you have employer provided plans, 401ks and Roths, whether you're with brokerages or mutual funds, you may have liquid assets. What do I do with all this? We can help you with that and get you scheduled to go over your financial needs. You can protect your principal. You can decide you want a little bit more growth. It may be income related, all of these things to help you because nobody wants to run out of money, right, as they're going through this. So what is the best way you can handle your financial assets? And so there are basically 3 phases as you go through this process. The first phase is what you're in now, right? You're attending today's educational seminar. Hopefully it provided a lot of information to you, but now we got to get specific. Phase 2, you schedule your free consultation. This is a one-on-one consultation with me in which we can go over your personal situation. Which of these things works best? How can we answer your questions? How can you be confident in the Medicare solution that you need or choose to have? So that's the second phase. And then the third phase is after you're on Medicare. Phase 3 is the support. What happens if you have questions? What happens when you're unsure or you get a bill that you didn't think you should have? Where can you go? We can help you through those questions. We provide that kind of support. Also, every year we'll do a free annual review. We'll go over those plans and the deductibles and the prescription drug plan or the Advantage plan. We'll go over all of that stuff, review to make sure you're still have the best Medicare solution for you. So why don't you schedule that free consultation? Don't waste time. Click on the blue calendar, right? It's right there either beside this or underneath this. Click on the blue calendar. You'll be able to schedule that one-on-one appointment. There's no cost, no obligation. I will just help educate you, help you get the best care you can. And in doing that, you'll get a personalized Medicare roadmap and a cost summary. Like, what are the things we discussed? How much is it going to cost? Who are the companies? All of that will provide to you after this free consultation. I want to thank you for watching, and I look forward to talking to you soon.